This is a joint news conference with UNM Children's Hospital, Loveless, and Presbyterian. And so we're just really grateful that everybody took the time to just meet with us and hear what's going on in our respective health systems. And we also are grateful for the opportunity to be able to educate our community of what level of care is required as we are really seeing a rampant RSV and flu and COVID season again. I'm going to turn things over to Dr. Anna Duran. She's the Associate Medical Officer for the UNM Children's Hospital.
Thank you and good morning. I really wanted to touch on why this season has been so different from seasons in years before. So within New Mexico, we are seeing a large number of children who are getting sick with different viruses. Generally, this time of year, we see an increase in the flu and the start of our RSV season. Not only are we seeing flu and RSV, but we're also seeing COVID, parainfluenza, vomiting, and diarrhea due to enterovirus. Because of these multiple viruses hitting all at once, many of our clinics and hospitals are really feeling the strain. So we wanted to have this discussion to see what our hospitals, how we're collaborating with one another, and what we are doing to address this need.
All right, Dr. Duran, thank you so much. Let's go to Dr. Mary Beth Thornton. And Dr. Thornton will talk about what we're seeing specifically at the UNM Children's Hospital.
Good morning. So currently we are above capacity in our children's units, and we have created additional care spaces to care for sick kids. These care spaces may not look like our traditional hospital room, but they do allow us to provide the care that is necessary for children who need to be hospitalized. It may take a little bit longer for your child to be seen in the emergency room or the pediatric urgent care center, but we're here to serve our community. We are also seeing some intermittent shortages of cribs, but we have a plan in place to address that. And our staffing is also stretched at this point in time. As we open up alternative care spaces, all of those spaces require pediatric nurses to care for the patients that are in those spaces. Our emergency operations center is open, and we're meeting several times a week to discuss needs related to the surge. And we also, as a leadership team in Children's Hospital, meet several times a day to pivot and make plans for the upcoming shift to care for the patients that are hospitalized, as well as the patients that are in our emergency department and our pediatric urgent care center.
Thank you. Okay, let's go now to Dr. Vesta Sandoval. She's the Chief Medical Officer for Loveless Health Systems.
Yes, thank you for being here this morning and for allowing us to talk about this really important topic for our community. As has been stated, RSV and all these other viruses, including influenza, have started to increase in our community. As an adult pulmonologist, I just want to remind everyone that, again, RSV typically is seen in younger age groups, pediatric age groups, but also can be seen in adults, particularly adults that have underlying lung disease. So some older adults can be very susceptible to RSV, and it can lead to hospitalizations, even ICU stays. In addition, we are seeing pretty rapidly increasing influenza A across the country, and it is also increasing here in New Mexico, as well as we still face our threats from COVID. So it's exceptionally important that we all work together. Our community has learned how to do this over the last years during COVID, and all of our hospital systems will work well together and try and do whatever we can to try and accommodate the numbers of patients that we're seeing that are being ill.
Thank you, Dr. Sandoval. I want to introduce Dr. John Peterson from Presbyterian.
Yes, hi. So much as you've heard from Dr. Duran and Dr. Sandoval, at Presbyterian, we are also running at and above capacity on a daily basis. We're also meeting as a leadership team on a daily basis to discuss how we can better streamline and utilize existing resources in all aspects of care, from staffing to triage to supply chain to pharmacy to transport. And I want to really emphasize that we really are working together. All of the hospital systems and all of the pediatricians in the state of New Mexico, all of the nurses, everyone is working together to ensure that the kids that are having these illnesses right now are getting the care that they need.
Thank you, Dr. Peterson. One of the messages that's really important for us to convey to the community is knowing the difference between when a child might need emergency care versus urgent care versus a situation that might be okay for home care. So Dr. Anna Duran is going to explain what parents can look out for. I'm sorry, Doctor. There you go.
Thank you. So many of these symptoms associated with these viruses can be similar. Some of the most common ones that we see with RSV are going to be cough, congestion, and fever. We're also seeing sore throat as well as vomiting and diarrhea. Now, if your child is not taking fluids, then you may see some signs of dehydration. Again, knowing when to seek medical care and where to seek medical care is the most important piece of this. Many of the symptoms can be managed at home. For instance, patients who have fever, fussiness, or pain can be managed with Tylenol. If they are older than 6 months of age, they can be managed with ibuprofen. For cough and congestion, we really do not recommend the use of cold formulas for children younger than 4 years of age. And for congestion, really the use of bulb suction or even the nose Frida can be very beneficial in helping to clear that congestion. With dehydration, the use of Pedialyte can be very helpful in helping children stay hydrated. Now, when we talk about when to seek medical care, there are times that you want to seek care either through your primary care physician or urgent care. And this would be if your child has had a fever for greater than 3 days or the start of dehydration, meaning they're not able to keep fluids down, or you may see their lips or mouth being dry. We do want to encourage you to seek emergent or emergency care should you see signs of respiratory distress, meaning your child is working harder to breathe or they are breathing fast, or also signs of dehydration, which include your child does not have tears when they cry. They might also include dry lips, dry mouth, or you may see decreased amount of wet diapers or decreased urine or peeing.
All right, Dr. Duran, thank you so much. To talk about some preventative methods and what we could be doing at home in our community, I want to turn back over to Dr. Vesta Sandoval.
Thank you, Chris. Again, we know the things that have worked well in the past to help prevent viruses from infecting our families and being spread across our communities. Hand washing and really very, very thorough hand washing, wearing a mask, being able to make certain that your children are vaccinated and that you are vaccinated. Vaccines will help us prevent influenza or lessen the impact of influenza. So it is still in the time frame where if you get an influenza vaccine and a COVID vaccine, this would be very helpful to help us prevent the spread of these diseases across our community.
Thank you, Dr. Sandoval. And let's go to Dr. Peterson to add on to that.
Yeah, I agree with all of the measures that Dr. Sandoval just discussed. I think that hand washing is so important, and it's not very easy to get our kids to wash their hands. There are some excellent videos on the CDC website that are really targeted towards parents to instruct their kids how to wash their hands. And I think practicing in the home setting so that when your child is out of the home setting, they're more likely to do that is extremely important. Masking is not a very popular thing. It's something that can be somewhat uncomfortable, but I think that for we've seen throughout the COVID-19 pandemic that masking works to prevent the spread of respiratory viruses, and so really encourage people to mask when in public settings. And then if your child is ill and they are able, keeping your child home from school. If the parent is ill and they are able, staying home from work are also important ways to prevent the spread of these viruses.
Thanks, Dr. Peterson. We're going to open it up to questions from reporters. If you could just indicate in the chat that you have a question. If you have a specific question for one of our providers, just let me know who that question is aimed for. If it's a general question, that's okay too. Let's start with Julia Goldberg from the Santa Fe Reporter. Julia, you can unmute yourself and ask your question.
Thanks, Chris. I think this is a general question for everyone. I was wondering, a year ago, when there was more COVID testing going on, not in homes, flu was being tested at the same time. Labs were running them at the same time. I guess I'm wondering what impact having so much home testing for COVID is having on healthcare facilities' ability to kind of know how much flu there is, or are people ending up in the hospital and then you're finding out they have flu? I think that's my question. Thank you.
All right, Julia, I think I can take that one. So most of our facilities, whether it's an emergency room, urgent care, have access to testing that would allow us to look at multiple viruses at one time. So we'll know if it's influenza versus COVID, versus even we can look for para-influenza virus. And as the point was made earlier, a lot of these viruses have overlapping symptoms. So it's important that we're able to do that, particularly in a situation where a patient may be more ill.
Dr. Sandoval, thank you. I think what I was trying to ask is the fact that people are at home taking a COVID test, it comes back negative and they think, oh, I don't have COVID. Are they then not getting healthcare treatment when they should because they just think they don't have COVID? Versus a year ago, you'd go get a COVID test and someone would say you don't have COVID, but you have the flu.
And again, I think sometimes it depends on the symptoms and the degree of illness. So certainly if somebody has experienced a higher degree of illness, has high number of risk factors, getting checked for the flu is important because there's treatment. There are medications that we can give for the flu. So I think that again it depends on your risk factors and the degree of illness that you're experiencing. Certainly, as someone else made the point, staying at home and not exposing multiple people when you're ill is also important, COVID or not.
All right, thank you. I'm going to just go in order as they're coming in on the chat. So Brianna from KRQE is next. Brianna, you can unmute yourself.
Good morning. Can you guys hear me? Perfect. Well, thank you, Chris and doctors, for holding this joint meeting. I have two questions here for you. How does the situation compare to the COVID surge that we've seen in the years past? And I'm curious to know if we're able to get some numbers from the different healthcare systems on this call in terms of specifically what you guys are seeing right now.
Since it's a question for everybody, maybe we can go Dr. Thornton and then Dr. Sandoval and Dr. Peterson to just update on your respective health systems.
As far as numbers, this morning we were at 119% of pediatric licensed bed capacity. It has varied, and over the weekend, typically things do tend to settle down a little bit, but the number changes on a shift-to-shift basis. And as far as the COVID surge goes, the COVID surge was primarily in our adult population. And so in our adult area, they were getting the kind of a surge that we are getting now. So it's just a different type of a surge because it's a different population that we're seeing at this point in time.
Dr. Sandoval, do you want to take that as well?
Yeah, certainly. So our COVID numbers have been relatively stable in the low teens across our system when we look at all three hospitals. We have, of course, been communicating and transferring and trying to load level across all of our facilities. But the surge really, again, it's related to multiple illnesses. So it's a very broad, multiple illnesses, people coming in with very high acuity needs. And it is not just related to viruses. It may be pneumonia and other types of needs as well. So our hospital is very full. All hospitals have been full. And basically it's a day-to-day, shift-to-shift sort of being able to find access. And particularly, we're also seeing a lot of transfers from across the state coming in centrally. And that has continued, has really not let up since the time of COVID. A lot of that's related to outside staffing challenges for facilities in small and rural areas of our state.
And Dr. Peterson?
Yeah, I think I think we focus a lot on the exact numbers, but there's a lot that really are determining the strain on the system that aren't just the numbers. And put things in perspective, if you look at the numbers of positive COVID cases coming through TriCore, they're still in the thousands. If you look at the number of RSV cases coming through TriCore, it's in the hundreds. But we're in a very different situation with these viruses. With COVID, we have vaccines, we have a lot of community immunity. We kind of have this immunity gap when it comes to other viruses such as RSV and influenza. So the impact that smaller numbers of cases can have on the system is very different. And we're also looking at the pediatric versus the adult population, and obviously pediatric population is the minority of the population. The majority of beds in the community are adult beds, and so we're looking at very different volumes of patients when it comes to numbers. But it's really the impact that is having on the systems that's really important to focus on.
Thank you. Ryan from the Albuquerque Journal has a question. Ryan, you can unmute yourself.
Hi, doctors. Thanks for taking the time to talk with us. I was wondering if you think that this increase in young children with these respiratory viruses might be because they've spent a pretty good percentage of their lives with like COVID restrictions and may have not been out getting exposed to viruses like they would have been, and if that might be one factor in this increase. And then a specific question for Dr. Thornton. You mentioned how UNMH has opened up an emergency operations center. I was wondering if you can just describe what that is and what's being done there. Thank you much.
I'd be happy to take the first part of your question. So yeah, I think that there is no doubt that the COVID-19 pandemic and the restrictions that we had in place are playing a role in what we're seeing right now. We typically have a large surge of RSV every season that occurs typically in the January to March to April timeframe. And typically all children by the time they are age 2 have had an RSV infection. The masking, the social distancing, the hand hygiene, all of the things that were in place during the COVID-19 pandemic did a good job of limiting the spread of COVID-19, but also for RSV and influenza. So absolutely, we are seeing children that typically would have been exposed to these viruses in the past through the annual or seasonal surge that aren't, and so we do kind of have this immunity gap, this lack of immunity in the community.
As far as the Emergency Operations Center, basically what that is a structure that allows us as leaders in the organization from a variety of different disciplines to get together and get our needs taken care of quickly. So for instance, I'm sorry, I don't know why that is not turning on. For instance, as operations last week, I was able to communicate needs for housekeeping in a specific area and some additional linens and pharmacy needs and so forth. And so you get a group together, logistics, operations, the PIO, there's like 8 or 9 of us that are in different roles within that to talk about kind of what the needs are to continue our operations moving forward. It's just a very convenient and formalized way to talk about what's happening in the system and get the needs met in a timely manner.
Thanks, Dr. Peterson and Dr. Thornton. Lauren from KOB has the next question.
Yes, good morning, guys. Thank you so much for holding this and allowing us to participate. So I had a question about 2 questions actually, and I'm sorry if this did just get answered. My Zoom kind of just crashed, so I just logged back in. But you guys, when we last spoke with you and speaking to you now, you spoke on the protocol for overflow and things of that matter. as things might possibly get worse in the next few months, what's the protocol in that? And secondly, is this another holiday season where we might see people having virtual Thanksgivings, or what do you guys recommend? Kind of like we saw with COVID recently.
Well, Lauren,
Dr.
I can.
Yeah, I'm sorry.
I was
Go
just
ahead.
going to say, I can let you know that we're at a state level. We're still meeting frequently, still having hub meetings with the smaller facilities and the outlying areas. And we still have our medical advisory team meeting on a regular basis to have these conversations so that we have an awareness of what's happening within the community, have communication among the larger systems on how to try and low level and manage patients so that if numbers do increase, I believe we're prepared to try to help each other get through this and make sure that we're doing the best for our patients.
Thank you, Dr. Sandoval. And our last question so far, unless anybody has anything else, Luis from Univision.
Hi, good morning, everyone. So Lauren, it was the same question that she asked. I spoke to a parent this past weekend, and they told me they had to wait around 10 hours to get a bed. So I just kind of wanted to know if there's going to be a surge of COVID or influenza, how are hospitals going to be preparing for the bed shortage? Are they going to be directing them to another hospital, or the situation?
Well, I think you've heard from UNM. They have set up their emergency management center. Again, we are all in communication through our call centers as well. So we communicate with the PALS call center through our one call system. And we have managed, and we have a sort of playbook of how we can try to work together as our systems become stressed with increasing numbers of patients. I do believe that over the winter, it's going to become more difficult, which is why these preventative measures are so important. Making sure you're vaccinated, making sure you're washing hands, try to avoid crowds. If you're immunocompromised or if you're concerned, make certain you're wearing a mask. These are the things that we know that will work to help keep the numbers of the infections at a manageable level so that we can make sure we're providing care to everybody in our community.
Thank you, Dr. Sandoval. Chris McKee with KRQE has the next question, and Chris, you can unmute yourself.
I had one question for UNMH, essentially in the sense of the Emergency Operations Center and what the effect is on patients. Would patients potentially notice anything different? Can they expect any kind of different treatment or experience at all under this sort of Emergency Operations Center protocol? And actually one follow-up, Dr. Thornton, you had mentioned, I think the capacity was about 119% beds, but how many beds do you have total?
It's really hard for me to answer how many beds total we have because it varies based on what alternative care sites we have open at any given time based on what's happening in the emergency room and in the pediatric urgent care center as well as in our surgical center. If you're asking about licensed bed capacity, I got to add it up real quick, but I will get back to you on that question. The Emergency Operations Center is just a mechanism for us to get together as a leadership team to problem solve together quickly and get needs met. So our patients wouldn't necessarily notice that piece of it. What patients will notice, or parents coming in with children will notice right now, and I'm sure this is the same in all of our systems, is because the system is seeing more patients, the wait times are going to increase. And the places where children are cared for may not look like your typical hospital room that you have been in the past. And so those are what our community and our parents will notice. We make sure that we have the staffing to adequately care for our kiddos and for our community. We're committed to taking care of our community, and we all work together very well to make sure, is there a capability at Presbyterian to take a child from the emergency room? Is there a child at Christus St. Vincent or Lovelace or Presbyterian that needs something that only UNM can provide? and we can transfer patients back and forth and work together to ensure kids are being cared for at the best place for them.
Thank you, Dr. Thornton. Ryan from the Albuquerque Journal has a follow-up question.
Hey, thanks again. I was wondering if you could describe the age of the patients that's driving this surge a little bit better. I mean, children are technically 17 and under, but when you were talking about symptoms, you were describing like diapers and being fussy and that sort of thing. So is this like under 5, or what would you say is the age of the patients that's driving this surge?
Yeah, thanks, Ryan. So, RSV, again, typically affects the younger you are, or if you are born premature, those are really the children who have more severe symptoms. Because children have been, if you will, immunonaive, meaning they haven't been exposed to a lot of these viruses, really what we're seeing is an older population. So RSV can affect, a 2-week-old, and we are even seeing children as old as 5 years of age being hospitalized with the need for oxygen because of some of these viruses, and most specifically RSV. So it is a variable age group right now. And again, back to the earlier question, I think this is just what we're seeing because children have not been exposed to viruses over the last, 2.5 years.
Thanks, Dr. Duran. And Brianna with KRQE has the last question of this call.
Thank you so much. I know we mentioned these topics briefly already, but I wanted to get some clarification. So first of all, what has been the response from the state's Department of Health? Of course, with so many, we're having this vigilance with so many healthcare systems in our state. Curious to know how the NMDOH is helping with that. And then secondly, this is a follow-up to, Lauren's question from KOB. I wanted to see if we can get a direct response to the holiday caution that those should take as we head over to Thanksgiving.
I will add to the holiday caution. I think anybody who is ill or has been around somebody who is ill should really limit their exposure to family during these gatherings. We are coming, up on Thanksgiving and then followed by Christmas. Anybody who is sick is really just has the potential to expose anybody they are around during these holiday celebrations. So again, just using caution. If you're sick, please stay at home. Keep everybody else in your family well.
Just second what Anna Duran is saying, because again, older adults can still be very susceptible to RSV, and particularly if they have underlying lung disease. So please keep that in mind.
Does that answer all of your questions, Brianna?
Yeah, I just had the other one about the State Department of Health, how they're helping with you guys in terms of their efforts.
Again, I think going back to the Department of Health having an awareness and letting primary care providers and other providers across the state, making them aware of the RSV surge, as well as supporting the structure of being able to continue the medical advisory teams and the hubs and spokes sort of structure, that if there are particular areas where these viruses are starting to increase, we have an awareness of that and can react to that well across the state.
All right, thanks.
I don't know if that answers your question, but.
Thanks, Dr. Sandoval. Just because I don't want to leave anybody out, we'll end with Lauren Green from KOB.
Thanks, Chris. Yeah, this will just be a quick one. And doctors, anybody can answer this, but I know we spoke on just getting in the habit, of course, even at home, like making sure your kids know how to wash their hands properly, things of that sort. But what kind of precautions can a parent have for their baby who's, being taken care of and they can't do any of those things by themselves at 2 weeks old? What should they be doing to prevent such an infant from catching this?
Thanks, Lauren. The most important thing a parent can do is really to limit anybody who is around that child. If they are sick, they should not be visiting that child. They should, particularly children in the first couple of weeks of their life, limit the exposure to these viruses. We are seeing a large number of very young children coming in, and most likely because their siblings are bringing home viruses, and it's hard to keep siblings away from siblings, right? So again, back to good hand washing, making sure that if a child is sick, they're not giving lots of kisses to their new infant sibling. And again, just trying to keep those who are sick away from those who are well.
Thanks, Dr. Duran. Thank you, everybody, for participating. We are currently putting together resources on our website. And so once we have that page built out in the next few hours, I'll make sure that we send it out to all of our media contacts on this call. With that, this concludes this news conference. And thank you, everybody. Thank you, our health partners, for participating. And thank you, reporters, for joining.